Hi, ladies and gentlemen. As you can see from the as you can see from the thumbnail, we are going to discuss on the blood glucose level. Blood glucose level. Blood glucose level. Blood glucose level. So, what is blood glucose level? Is the amount of sugar present in the blood. The amount of sugar. When we say glucose, we mean sugar. The amount of sugar present in your blood. That is the blood glucose level. So now, what are the normal values of blood glucose level? It differs based on the scenario. When it is fasting, there's what we call fasting blood sugar, random blood sugar, 2 hours postprandial, and glycated blood glucose level. So let me just go on the fasting blood sugar for now. Before going to the fasting blood sugar, whenever you are around 30 years, you have to be monitoring your blood glucose, because at that time your body systems tend to start weakening. If you are taking anything how foods, the regulatory system of your sugar level, it will be impaired. So you have to know what the kind of food you are eating. At that age, you have to cut down some sweetish beverage. Any sweet beverage, you have to cut down, and you have to reduce alcohol, smoking. You have to be taking enough beverage, enough vegetables. You have to be taking enough water. You have to be doing exercise for you to control your sugar level. At that very years of time, when you are about 30 or 35 years above, these are the things that you need to understand. You have to cut down sweetish beverage food. Any sweet beverage food, you have to cut down it. You have to stop or reduce taking alcohol. Then you have to be taking enough of water. You have to be taking enough of vegetables, enough of vitamins. Okay, now, what is blood glucose level? The amount of sugar level that is there in your blood system. The amount of sugar that is present in your blood, that is referred to as blood glucose. When we say glucose, we mean sugar. This sugar can be found in the food we are eating. Thank you. This sugar can be found in the food we are eating, like rice, like yam, cassava, millet, guinea corn. All this kind of food, they contain sugar. So when you are eating this food, you are not balancing it with the protein. There are tendencies that your blood glucose level will be higher. And when you are overweight, when you are fat, and you are not exercising, there are tendencies that your blood glucose level is going to be high. And then when you are taking some food like alcohol, there are also tendencies that your blood glucose level will also be high. At that time, from Los Angeles, thank you, my guy. At that time, okay, thank you, sir. At that time, you need to understand that blood glucose level is something that will live with it, and it's something that you cannot do without. But when it is out of control, it becomes a disease. That is why you will say somebody comes out with diabetes, either diabetes mellitus or diabetes insipidus. But we are talking about diabetes mellitus. And this diabetes mellitus is divided into two. We have the insulin dependent and insulin non-dependent. Most of the condition that adult, especially from 30 years above, comes with, they are insulin non-dependent. It's as a result of the aging process, as a result of the lifestyle that we are involved in. You eat this, you eat that, you eat this, you eat that, without controlling your diet. That is diabetes, diabetes type 2 diabetes. And as I said, whenever you are 10 years, you are 30 years above, please control your diet, because diabetes is something that you can live with it for more than 30 years. You can live with it for more than 30 years unless you control it. You know whether you have it. When you control your diabetes, you can live with diabetes for more than 30 years. But when you didn't control it, within one year, diabetes will put you down, because it's something that has to do with the metabolism. I know when your body metabolism, when your metabolic process becomes altered, what do you think will happen? It's going to shut down all your body system, because metabolism control all your body. You control your brain, you control your heart, you control your genitourinary tract, you control virtually all the system in your body. Metabolism is controlling it. But diabetes is a metabolic hormone. Please subscribe to my channel. Subscribe. I love that. Subscribe, please. Subscribe and like the video. Yes, subscribe, please. Subscribe and like the video, and let me know your opinion in the comment section. As I said, metabolism, diabetes is a metabolic disease. So when the body is not able to control, to regulate your blood sugar, that is where it's going to affect your heart. You come out with atherosclerosis. It's going to affect your body weight. It's going to give you obesity. It's going to affect your sleeping patterns. It's going to affect your brain. It's going to affect your kidney. Virtually all the systems, metabolic diseases or diabetes can affect it. Okay, you are going to sleep, huh? Okay, wow, go. You can go to sleep. You can go to sleep. Harry, Funnies, thank you for that. Okay, me, I am here. Yes, I am here. Whatever thing you say, when you wake up from sleep, you come and meet me here. Thank you, sir, Mr. Harry Funny. Then when this blood glucose level, when it is become high, it's called hyperglycemia. Then how do you know that your blood glucose level is high? One is when you go to the hospital. And for instance, let me give you the sign. When you started having weakness, chronic fatigue, that is, you are experiencing weakness without any particular problem. And when you started, having you are testing, you started drinking water excessively, and you are passing out urine excessively, and then you are eating also more than usual, then something must be wrong. You are eating and you are still hungry, something must be wrong. When you go to the hospital, maybe the doctor will ask you not to eat and come on the following day. When you come on the following day, then the lab scientist will now get your blood and test run it. When the blood glucose level is less than 6, is around 3.9 to 5.5 or 5.6, you are within normal range. Your blood glucose level is within normal range. But when it's above 5.6, let's say it's around 6.9, that period is called pre-diabetic. You are in pre-diabetic state. That is when your blood glucose level is more than 5.6, is around 6.9, is pre-diabetic state. But when it's above 3.9, is above 7, is around 7.0 or 7 above, you are diabetic. So what we are saying now is diabetic, especially diabetic mellitus type 2 diabetes, is something that has to do with aging, has to do with um, hereditary, has to do with the lifestyle. So when you are taking food anyhow, especially this sugary beverage food, you are prone to come out with diabetes. So what we are saying now is to know whatever you are around or you are about reaching 30 or your late 30, please stop taking or reduce the rate of taking this uh, refined and beverage sweetie food. Then that is the first point. The second point is that there's what we call second point of on knowing your diabetes, whether your blood sugar is high. There's what we call random. This random, you come to the hospital at any time, whether in the morning, in the evening, in the evening, even in the night. As I'm talking to you now, when you come and when I check your blood, it's called random. And then there are values that will determine whether somebody is diabetic or not. When it is around 7.8 is normal. If it is random, 7.8, if it is random, is normal. Meaning, irrespective whether you've eaten or you don't eat it. Well, do we ask you, what have you eaten? When you say you've eaten, then the blood sample is taken, then after analyzing, and it comes out with 6 or 7.9, 7.8. At that 7.8 to 11, at 7.8 is normal. Then 7.8 to 11 is pre-diabetic. Then after 11 is diabetes. After 11 millimole per liter is called diabetes. That is at random. But at fasting, when it is 3.9 to 5.6 is normal. 6.9 is pre-diabetic. 7 is diabetic. I don't know whether I'm communicating. Please, if you don't understand it, let me know it in the comment section and ask me. I will repeat it. I said if it is fasting blood sugar 3.9 to 3.9 to 5.6 is normal. When it is around 6.9 is pre-diabetic, and when it is more than 6.9, when it gets to 7 is called diabetes. Then when it is random meaning your blood is taken at any time, irrespective of the time you come to the hospital, the blood is taken. And when it is 7.8 is normal. 7.8 to 11 is pre-diabetic. Then anything after 11 millimole per liter, that is the standard value. 11 millimole per liter is considered diabetes. Then this is what do you call it? Random. Then there's postprandial. Postprandial meaning you come to the hospital, your blood is taken, and you've eaten. You will be asked to wait for 2 hours to come and check your blood again. Meaning you eat for 2 hours, you eat, then you wait for 2 hours when the food might have been digested and absorption, then your blood sample will be taken and analyze it again. When the value still is around 7.9 is normal. 11 is within range. 11 is pre-diabetic. Then after 11 is diabetes. Just this random and 2 hour postprandial, the value, they are almost the same thing. The most important thing is the fasting, and there is what we call glycated hemoglobin. This glycated hemoglobin is going to tell us how hemoglobin is able to control or to regulate your sugar level for the past 3 months. The first 3 months, how glucose is able to control your how hemoglobin is able to control your blood glucose in the last 3 months. That is glycated hemoglobin. It's one of the best method of knowing whether somebody is diabetic or is not diabetic. So when we say blood glucose level, we mean the amount of sugar in the blood. That is all about it. If you have any question, you ask. Then what are the management? The management is simple. Yes, please like the video. Please like it. Please give me a like. If you know, if you are enjoying what I'm saying, please give me a like and give me a subscribe. That one. Then what are the management? Management of diabetes is very simple. It's a lifestyle modification. If you know that you are eating anyhow food, stop eating or reduce the intensity. If you know you are drinking alcohol, stop drinking or reduce the intensity. Smoking, reduce the intensity. Exercise, you have to be exercising at least, walk like 30 minutes in a day. It's okay. You're going to burn some fat. Then if you can be drinking water, enough water, be drinking it, especially in the morning. Drink water, and take enough of vegetables. Eat a lot of vegetables and vitamins. These are simple, because your diabetes is not an insulin dependent. It's just it's insulin non dependent, meaning with diet you can control your diabetes. So that is why managing diabetes is very simple. You manage diabetes is very simple in the sense that you know what you are doing. But if you don't know what you are doing, it's very difficult. And whenever diabetes set in and you don't control it, and it lead to the somebody having what do you call it, wound, it will be very difficult to be healed because of the sugar, high intensity of sugar in the bloodstream. So please try and manage your blood, try and control your blood sugar, and try and know what you are doing. Then what are the signs and symptoms? What are the complications? The complication, it will be affecting eye. Yes, somebody will not see clearly in the dim light, or somebody will not see clearly because of the retinopathy. It will also be going to affect your performance. As a man, you will not perform very well. Your wife needs you, but because of the diabetes in you, it will not allow you to perform very well. So at that very point of time, you have to know the kind of food you will be eating in order to control the diabetes. Otherwise, you'll be having you'll be having problem with your wife, because whatever thing you do, you're not going to satisfy her. The sugar level, the sugar tends to destroy your blood vessels that is carrying blood, the peanut blood that is carrying peanut blood vessel that is carrying blood to your genital area. Then there will be problem with the hypertension. There will be hypertension. Somebody will become hypertensive. It leads to renal issues, kidney issues. All these are the complications associated with the diabetes. So please, diabetes is manageable. Diabetes is preventable. Diabetes is a friend when you know what you are doing. Diabetes is not a death sentence. Whenever somebody has diabetes, meaning it's not a death sentence. Meaning whatever if that person knows what he's doing, he's going to live with the diabetes for the rest of his life without being harmed by it. But when you don't know what is called diabetes and you are not able to pay attention on this kind of health education we are giving online for free, okay, you are going to be we are going to really start with the hospital and becoming every day because of control of diabetes. For this, if you have any question, ask. I want to go to sleep. If you enjoy my lecture, please and please subscribe. Please and please subscribe. Encourage me to do more by subscribing, by liking the video. If you didn't like my video now, like my what am I doing? Like it now. Like it. Yes, please like the video. Like it. Yes, like it. Like it, please. Like it. Like that. Any question? Any question? Okay, that's also of any question. Let me call it a day. Bye bye. We'll meet tomorrow.